Action. All right, everybody. So, Joe asked me about dumping. Specifically, what happens or what's going on when somebody eats and then has to run straight to the bathroom to have a bowel movement. Now, you would sometimes consider that normal if you're an infant. In fact, when you're a baby growing up, there's something called gastrocolic reflex. And the gastrocolic reflex is there because at the time that the baby's feeding, whether breastfeeding or bottle feeding, usually within about 30 minutes, you'll see the baby start to strain, Valsalva maneuver, to have a bowel movement and change diaper. So that has been a necessary reflex so that whatever is coming into the stomach is now being given ample room in the colon, and the colon actually goes through its dumping maneuver because of the reflex that gets stimulated from the stomach. So without going through the hormone cycle that causes that reflex to occur, remember the GI tract from mouth to anus has its own nerve plexus. It's got its own brain, so it's an involuntary system. It goes, it secretes, it digests, it usually finishes and leaves the body on its own without us even thinking. The change, or the only voluntary muscle that's in the gastric tract, is going to be the sphincter of the anus. And that's because we can learn to, as we get older, we learn to control and hold when a potty is available, when we think it's accessible, or when it's proper, because we have a lot of things to do. When we're infants, it doesn't matter, right? So the one problem that I see occurs is when we're in times of stress or stressed out, that sphincter sometimes holds it and becomes an iron door, even if the gut is saying it has to empty. And that's when you start to get into a bad habit or irritable bowel syndrome. So it always is important for us to honor the signals or the messages that the stomach and the small intestine and the colon are giving to us. When in times of stress we ignore them, it's okay for a day or an episode, but we constantly ignore them, it usually becomes a battle between the involuntary and the voluntary system. So the other thing that also throws a wrench into this is that when you change your diet, when you have a difference in consistency of your coffee, when you have a difference in the amount of dessert, candy, pop, that all will cause an irritation every once in a while to the lining of the stomach. When the stomach doesn't like that, it either pushes it up and makes you vomit, or it pushes it down and makes you dump, makes you want to go to the bathroom quickly. Again, that shouldn't be a common occurrence. It should be maybe on the weekend only, 1 meal, 2 meals a week. But when you're constantly experimenting, when you're eating bad quality food, when you're eating bad food, highly processed foods, things with high alcohol content, high caffeine content, or when you're a reflux sufferer and you take in tomato, coffee, coffee bean, caffeine, peppermint, chocolate, spicy foods, those are all going to make a reflux issue worse. See my video, DrRIc tutorial GERD, and it'll give you some ideas. But those are the typical things that cause your normal pattern to go off pattern. Now, if I have somebody that is going through an urgency and it's difficult to control and it's associated with foul-smelling gas, then usually something just happened to the gastrointestinal tract. And the biggest trauma that can happen to the gastrointestinal tract is actually me. I can give antibiotics and I can take care of a sinus infection, a bronchitis, a urinary tract infection, but unfortunately the side effect of antibiotics is we wipe out all bacteria everywhere. So it doesn't matter which area I'm treating for an infection, a bacterial infection, but when we knock out the bacteria in that one area, we unintentionally kill, has collateral damage, every bacteria in your body. So sometimes women will have the symptoms of a yeast infection in the vagina. Some people will have diarrhea, especially kids. Some people will start to become IBS-like symptoms, or have symptoms like IBS, irritable bowel syndrome. And it usually results in that foul smell where you can normally tolerate your foods in any kind of environment. Well, after a round of antibiotics, when the flora in the gut changes, you'll have intolerance to your normal foods. So that's when the system has to be reshocked. You have to You have to learn what you can back off on or retreat to. Usually bananas, rice, applesauce, and toast diet is a relatively okay diet, low residue, doesn't irritate the gut too much, but gives you a little bit of energy. That's the old adage, brat diet, bananas, rice, applesauce, and toast. We give it to our kids all the time for the short day or 2 days that they have a vomiting episode or diarrhea episode. Sometimes if you back off to that, low residual foods, stop all those foods that I talked about with the GERD diet, and get on something to calm down the acid. Sometimes you can do Tagamet, Pepcid, Zantac. I don't like to go straight to the Prilosec, Previcids, Nexiums because that seems to cause an addiction problem later on and you can't get off of them. So decreasing acid would be one thing. Sometimes getting in DGL or chewable DGL will coat the stomach and help it soothe and heal up fast. Sometimes even using a probiotic or digestive enzymes during the time that you're rebuilding the gut would be important because it's not working properly. We want to give less work to the stomach. The digestive juices that don't flow you can take in the form of digestive enzymes, usually 10 minutes before each meal. You do that, you take your foods to a lower residue, you try to avoid offending agents, you try to avoid irritating or stressful events, and you try to be regular with your eating habit. You introduce that same brat diet or low residual diet 3 times a day. 3 times a day, maybe a snack on a routine basis so the timing is regular. You sleep at the usual time, you exercise at the usual time, and usually you can reset your clock, the gastrointestinal clock, within about 2 weeks. You will lose weight, that's expected, 5 pounds maybe. You do have to keep on with fluids, but you have to avoid coffee and alcohol because those are irritating. So tea is very soothing, chamomile tea. Sometimes there are soothing agents that will help, like marshmallow root, but those are powders and those taste really earthy. Slippery elm, marshmallow root are things that you can take in if you have a good herbalist that you can go to. Otherwise, DGL, as I mentioned before, is easy to find in most over-the-counter places. You have to like the taste of black pepper, black licorice, because it does taste that way. If you don't heal up within about 2 weeks, then you have to see one of us for blood testing. Sometimes you'll actually have a C. difficile infection. That's a fancy bacteria that is left over after we wipe out all the regular bacteria. Or you'll have a fungal infection, a yeast infection, candida, that won't stop until we hit it. There are herbs you can use for that, but again, it's complicated and you might have to get to us for testing. So hopefully this helps. If you have any further questions, post them underneath this video. And what do you do with a dump? What do you do with dumping? What happens when the belly has to make... Ah, shoot. Can you come back here and do that?